You definitely have a few inquiries concerning regenerative medicine, just like the majority of individuals. It is what? How does it function? Who stands to gain from it? We will address all of your concerns and provide you with a thorough review of this state-of-the-art medical equipment in this post. Keep reading because you'll learn everything there is to know about regenerative medicine by the conclusion of this essay. Let's get going. What is regenerative medicine? A subspecialty of medicine called regenerative medicine is dedicated to the regeneration of tissue and organs. It entails replacing or repairing damaged tissue and organs utilizing stem cells, which are unspecialized cells with the ability to develop into specialized cells. Patients who have had illnesses or accidents that have caused the loss of tissue or organ function may be able to regain function with the help of this stem cell therapy treatment. It offers one of the finest chances for curing diseases that are now thought to be incurable. To create novel treatments, regenerative medicine need a multidisciplinary strategy that brings together biologists, engineers, and physicians. Regenerative medicine strives to restore the function of damaged tissue and organs by repairing or replacing them. This area of medicine has the potential to transform the way we handle illnesses and injuries while also raising millions of people's standards of living. How does regenerative medicine work? The body's innate capacity to repair and regenerate tissue is used in regenerative medicine treatments. In many instances, healthy tissue that is similar to the original is used to replace the injured tissue. Stem cells, which are unspecialized cells with the ability to develop into specialized cells, enable this process. Stem cells develop into the particular cell types required to heal the damage when they are introduced into the injured tissue. This method may be used to treat a variety of illnesses and injuries. The treatment of heart disease, diabetes, and Alzheimer's disease are some of the most promising uses of regenerative medicine. Types of regenerative treatments. Regenerative medicine therapies are now being developed in a variety of forms. These include of tissue engineering, bioartificial organs, and cell-based therapeutics. Stem cells are used in cell-based treatments to restore or repair damaged tissue. Stem cells are frequently injected into the wound to aid healing. The process of tissue engineering entails the production of new tissue to replace damaged tissue. Cells and biomaterials are used to produce this new tissue. In order to replace a damaged or absent organ, the body might be implanted with bioartificial organs. The branch of medicine known as regenerative medicine is one that is expanding quickly and has the potential to revolutionize how illnesses and injuries are treated. Millions of individuals worldwide may benefit from this state-of-the-art medical technology in terms of quality of life. Who can benefit from regenerative medicine? Anyone who has had an illness or accident that has caused the loss of tissue or organ function may benefit from regenerative medicine. This includes those who suffer from illnesses including diabetes, Alzheimer's disease, Parkinson's disease, and heart disease. Additionally, regenerative medicine may be able to aid those who have suffered injuries in accidents or battles. Regenerative medicine may thus be appropriate for you if you have a disorder that has caused a loss of tissue or organ function. This state-of-the-art medical technology has the power to improve your life. Find out if regenerative medicine is a possibility for you by speaking with your doctor right now. Benefits of regenerative therapy. Utilizing the body's innate capacity to regenerate and repair damaged tissue, regenerative treatment offers a means of promoting overall health. Numerous illnesses, including as arthritis, tendinitis, and damage to the spine and neurological system, have showed significant promise when treated with this kind of therapy. Reduced inflammation throughout the body is one of the main advantages of regenerative treatment. Although persistent inflammation can cause a number of health issues, it is the body's normal response to injury or illness. By encouraging the body to produce anti-inflammatory substances, regenerative treatment can aid in the reduction of inflammation. Risks associated with regenerative therapy. Regenerative treatment carries potential dangers, just like any other medical procedure. These comprise the potential for infection, hemorrhage, and injection-related complications. Working with a trained doctor can help to reduce these risks, which are often modest. It's crucial to discuss the advantages and disadvantages of regeneration treatment with your doctor before moving further. This will assist you in determining whether or not this sort of therapy is appropriate for you. The field of regenerative medicine has a bright and promising future. This subject has the potential to improve the lives of people with a wide range of ailments with sustained study and development. Talk to your doctor right away if you're thinking about regenerative therapy to find out if this innovative procedure is good for you. Hopefully today's article was helpful to you. Please, don't forget to leave your reaction down below. Thank you. See you in next video.